A third vaccine enters the fight. A shot for a shot. Concern about variants and challenges from line jumpers. This is your weekly dose, where we round up the week's news on COVID-19 vaccines. And don't worry if we move too fast through a story. Links to all the articles are below in the description. In the race to vaccinate, this week 11 million people were vaccinated in the US, including Queer Eye for the Straight Guy's Jonathan Van Ness, a stark departure from the legends of 70s rock we've noted over the past 2 weeks. That brings the national total to over 70 million vaccinations, with 22 million fully vaccinated. States are working to complete Phase 1A vaccinations of healthcare workers and nursing homes, and begin Phase 1B, which includes seniors and frontline essential workers, though some states have added other groups, like those with medical conditions and caregivers. Overall, the country is seeing a sharp drop in COVID-19 cases, though at this point that is likely more due to the flu season winding down than vaccines. But there is a caveat, which we'll get into later. The CDC's daily totals showed a steady drop in administrations, but it is important to remember that these numbers lag a week behind. The latest rolling average is about 1.3 million vaccinations a day. With this drop, the country would now achieve herd immunity by January 29, 2022. But don't worry, these averages fluctuate, and there is reason to believe that next week's numbers will be far more positive. Internationally, the US leads the world in administered vaccines, but on a per capita basis, Israel remains ahead by a wide margin. With 2/3 of its population vaccinated, Israel has had to be creative in reaching the remaining reluctant 1/3. It is now targeting younger populations by setting up vaccination stations at the bars and trading a shot of liquor for a shot of vaccine. This could be a picture of things to come in the US, as surveys indicate 1/3 of US military personnel, mainly those younger, are rejecting vaccines. The government has begun enlisting celebrities for ad campaigns targeted towards combating hesitancy. On the vaccine development front, more good news this week for Pfizer's vaccine, with studies showing the vaccine is almost 90% effective at preventing COVID transmission and 99% effective at preventing COVID deaths. Still, other studies are showing that just one dose of the vaccine could be strong enough to protect those who have had COVID-19. There was a flurry of activity this week on Johnson & Johnson's one-dose vaccine. On Wednesday, the FDA announced that the vaccine was safe. On Friday, its vaccine review panel approved the vaccine, and the FDA itself approved the vaccine on Saturday. The next day, the CDC's panel of vaccine experts approved the vaccine, and the CDC followed shortly after, meaning the vaccine can now be shipped out for administrations across the country. While Johnson & Johnson had said initial supplies will be limited, it testified to Congress this week that it expected to have 20 million doses available by the end of March and 100 million doses available by the first half of 2021. But with months of experience and positive news about the Pfizer and Moderna vaccines, the challenge now is to convince Americans to also trust the Johnson & Johnson vaccine. Vaccine maker Novavax recently announced that it had completed international Phase 3 trials and would begin a rolling regulatory process with the FDA while it completed US Phase 3 trials. AstraZeneca had completed Phase 3 trials of its vaccine in January. While it planned to submit an application for authorizations, questions about the company's testing threw that process into doubt. The vaccine has not been approved in the US. However, the company is expected to soon release results of US trials, which could bring more clarity to its effectiveness. Otherwise, the vaccine has been approved in many parts of the world. Within the UK, where it was developed, it has been a major source of vaccinations. However, lingering doubts about its effectiveness have caused a substantial amount of the vaccine to go unused in the rest of Europe. Moving to COVID variant vaccine news, while there are thousands of COVID mutations around the world, the CDC is currently tracking 3 particularly concerning variants. The UK variant, first discovered in Kent, England, is a more contagious strain and is expected to become the dominant strain in the US, which we may already be seeing. Returning to the COVID-19 cases chart, while we have seen a substantial drop in cases, note the slight uptick at the end. The CDC is concerned that the UK variant may be stalling the drop in COVID-19 cases. Fortunately, studies indicate that the variant has little effect on vaccine effectiveness. Another variant receiving a lot of press was first identified in South Africa. Studies are showing that available vaccines are less effective, possibly even significantly so, against the South African variant, though they are still protective. But vaccine makers are fighting back. Moderna is beginning tests on a booster shot that targets the variant, while scientists are also working to refine the AstraZeneca vaccine's effectiveness against the variant. Though less discussed in the media, concern is growing over the Brazilian variant. It shares the South African variant's mutation that appears to make vaccines less effective on the virus. Of particular concern, The variant ran rampant in areas of Brazil thought to have achieved herd immunity, meaning that regular COVID antibodies, whether from infection or vaccine, may be significantly less effective against the variant. Indeed, the daily death toll continues to increase in Brazil, with scientists pointing to the variant as a driving factor. Finally, in news from the line, concern grows about the impact of forged vaccine documents. In LA, a mother authorized for vaccination as a caregiver of young triplets with lung disease attempted to provide papers verifying her status. However, she was turned away when officials, aware of forgeries circulating on the web, deemed her documents to be fakes. Vaccines will hopefully become widely available in late spring, but till then, states as well as those who need vaccines can expect to face challenges like these caused by those trying to jump the line. And that was your weekly dose. If you enjoyed this video, please click the like button and subscribe to the channel for more videos on COVID-19 vaccines. If you have any thoughts or questions, please leave them in the comments. And as always, stay safe.